morning. I hope you all had a good Memorial Day weekend. I know it was very different for all of us, remembering those that have made the ultimate sacrifice for our country, but we thank them, and it's always good to every day give them thanks for all that they've sacrificed for us. And Memorial Day really is the start of summer season for us, so a lot of people were taking advantage of the weather to get outside, at least on Saturday and Sunday. Our parks were busy, not overly crowded, but people were getting out and about and enjoying this beautiful county we have, and we appreciate that. For the most part, people were social distancing and following the rules, and that's really great because that's absolutely critical to us being able to reopen and get to the next phase of the state plan to reopen. And I was looking at some numbers, and excuse me, Dr. Spitters, but from the health district last week, and what was notable to me was clearly about 63% of the cases that we know about in Snohomish County were acquired either through community contact or close contact with a relative or a friend, somebody known. But only about 17% the numbers I was looking at were in senior care facilities. So a lot of times I hear that this is really a senior care facility problem. It is not. It's very much an issue for all of us. And so maintaining social distancing, wearing a cloth covering over your face when you're in areas where you can't keep distance, washing your hands, all those things we've been talking about are really important for us to be able to move to the next phase. And I know there's a lot of urgency. A lot of people just want to reopen now, especially businesses that are hurting so badly. We understand that. We're trying to get all the resources in place so that we can move to that next phase. I think the worst case scenario is if we open too soon and we get a large rebound of the virus in the community. That's going to be a disaster, even worse than the sort of slow reopening we're doing now. So we did get to stand up our small business and aerospace grant program last week. We've had a lot of interest in that. I think last count with the small business fund, we've received over 1,500 applications for grants. And so we are processing those as quickly as possible. Really know the time's critical to many businesses, so we're working to get those out in the coming weeks to those businesses. And we really hope to have some further rounds of that as we get into this. But we're learning, make sure the program works well. And there's a lot of interest, and we understand there's a real sense of urgency. So the requests are going to outstrip the resources that we have really dedicated to that in the first round. But again, we'll try to come back and do everything we can. And again, we're working as quickly as possible to get to a place where we can reapply or apply to the state for moving to the next phase. So with that, I'll turn it over to Dr. Spitters.
Thank you, Executive Summers, and good morning, everyone. Just a few short comments today, some data updates, and then a brief mention about testing. Regarding the data, reminder that what I present here is updated as of this morning and could change slightly before our routine posting, daily posting at 2 p.m. this afternoon. So I think the first thing I'd just like to highlight in our data is that, again, over the past couple of weeks, we've seen it's a flattening decline as we come down from the peak that we experienced about 6 to 8 weeks ago. And we had been plateaued in the mid to low 20s number of cases reported per day. And I'd say in the past 10 to 14 days, we've seen most days have had case report totals in the mid-teens, 15, 18, 17, a couple of days higher up in the 20s. But overall, in the past 2 weeks, we had 240 cases reported as opposed to 308 during the weeks 2 and 3 ago. So the 2-week cumulative case count has continued to come down. And of course, remember that's relevant to what Executive Summers is addressing in our efforts to be ready to reopen. One of the key factors is having the number of cases low enough so that our containment efforts are likely to be effective. So that moves that progress continues toward that target of ideally having fewer than 80 cases in any 2-week period. But we're not quite there, but we continue to move in the right direction. Again, most of the cases acquired in the community, not in long-term care settings. Most either have a known contact who had COVID recently, or they don't know where they got it. Long-term care facilities and healthcare workers are the next two most frequent groups. And another thing to keep in mind is that over time, since the peak of disease activity 6 to 8 weeks ago, the proportion of cases that have no known, we say, epidemiologic risk, whether that's a contact to a known case, working in a high-risk setting, residing in a high-risk setting, the number of cases that don't have any of those features, that sort of have, in essence, an infection of unknown source, which is the greatest concern, because that many cases like that suggest that there's ongoing community transmission that we're not aware of. The proportion of cases that fall into that category is steadily continuing to decline over time. So that's also a reassuring indicator of things moving in the right direction. Another item, just so you know, on our counting, when we count the prior 2 weeks, we're counting from the preceding 2 weeks that go from Sunday to Saturday, because that aligns with the Federal Centers for Disease Control and Prevention week designations. So again, from 8/10 to 23, the case count was down to 241 from the 308, the preceding 2-week phase. About testing, press release did go out on Friday announcing that we will be testing this Thursday at the Snow Isle Libraries branch in Snohomish. Registration is now open for appointments from 9 a.m. to 2 p.m. on Friday and on Thursday, excuse me. And with the appropriation of the CARES Act funding last week, one large piece of our work going forward is, again, ramping up testing across the county, having setups like that on more days than we don't. And our team is actively working on that, and continue to look for announcements on testing dates next week. And so with that, thanks for your time and attention, and I'd like to turn it over to Meghan King, who comes to join us today from the Washington Poison Control Center.
Thank you, Dr. Spitters. Good morning, everyone. Thank you for having me here today. So for those of you who are unfamiliar, I'll just give a little overview of what the Poison Center is. So we are a nonprofit organization that serves the entire state of Washington with a 24-hour emergency telephone helpline. This helpline is staffed by specially trained nurses and pharmacists, and they provide free and confidential treatment advice to folks who have been exposed to potentially harmful substances like chemicals, medications, drugs, alcohol, etc. So during this pandemic, we have actually seen an increase in poison exposures, both accidental and intentional, to a lot of substances that are commonly used for COVID-19 transmission concerns or precautions. So specifically, we've seen increases in exposures to household cleaning products, bleach, rubbing alcohol, and hand sanitizers. So we released a data dashboard last week that I encourage you all to take a look at. It is posted on our website, which is wapc.org. Again, that's wapc.org. So the dashboard compares calls to our telephone helpline from the first 118 days of 2019 to the same days, 118 days in 2020. So this year, we have seen a 52% increase in kids being exposed to hand sanitizer. So those exposures stem from a lot of different reasons. So it might be kids licking their hands after they've had hand sanitizer applied, or they might be getting it in their eyes, or they might even be taking a drink out of a hand sanitizer bottle. We've also seen a 53% increase in misuse of household cleaning products, bleach, and rubbing alcohol. So misuse means using a product inappropriately, and that can be either intentional or accidental. So some things that we're hearing about are people applying chemicals to their faces or their hands. Some people are using chemicals to disinfect their groceries and their produce. Some folks are mixing cleaning products together, which can inadvertently produce toxic gases. Or we've also heard about people that are spraying or soaking their masks in cleaning chemicals, which then when they put those masks back up to their faces, they're inhaling fumes and they can have skin irritation as well. We've also had a lot of calls about kids who have gotten into products that have been left open or unattended while their parents or caregivers are cleaning. So I was asked to provide some prevention tips this morning for you all, and thankfully with cleaning products and hand sanitizers, poison prevention is pretty simple. So first, to just wear gloves when you're cleaning and open windows and doors for ventilation. Never mix cleaning products, especially anything with bleach in it. Do not use any cleaning products on food. And we also tell folks to store any potentially harmful substance. So chemicals, cleaners, hand sanitizer, medications, anything that might be harmful, keep them in their original containers up high and out of reach of any children. And for masks, we know that we need to clean them regularly, so just wash them with soap and water or put them in the washing machine. Do not spray or soak them with any cleaning chemicals. And finally, give us a call at the Poison Center with any questions about safe cleaning, or if you have a poison emergency. We are always open. Our hours have not changed during this pandemic at all. So call us at 2 a.m. or 2 p.m. and we will be there ready to help. And the good news is we can usually keep you home as well. When we looked at folks who called us about hand sanitizer, household cleaning product exposures, all those things that we reported on during this pandemic, we treated 87% of them at home, which out of the emergency room and saved them a lot of healthcare dollars. So our number is 1-800-222-1222. Please give us a call at any time.
Thank you, Megan. So we've got a couple of questions. The first is that last week we mentioned that Snohomish County would not likely meet the criteria to move to phase 2 by June 1st, but now we're hearing that the Department of Health is saying that the criteria may not apply to the rest of the state moving to phase 2, only those counties applying early. Dr. Spitters, perhaps, can you clarify what the criteria Snohomish County needs to meet to move to phase 2? Do you still think June 1st is too soon?
Well, Executive Summers, we're still operating according to the directions given by the Secretary, addressing the categories of conditions or activities that are needed to return or to transition into phase 2. And the letter of those guidelines indicates those more as objectives to meet. Whether those are negotiable, I think we'll begin to address with the Department of Health. But needless to say, whether those are absolute indicators that we must meet or relative, negotiable goals, where we're working on all that activity, characterizing it, and are in discussion with the state about how things will move forward in Snohomish County, but I can't go further than that right now because I don't know.
Yeah, I guess I'll add that we are in contact with the governor's office daily, and there's several aspects to the criteria. Some of them are case numbers and trends. Some of them are having provisions in place, such as adequate PPE, adequate quarantine sheltering sites. And those are two things that my Department of Emergency Management is working on. The others are testing and contact tracing, which Health District is taking the lead on. So we're working every day to increase our capacity in those areas, and also watching as the numbers move down. But we also are discussing with the governor's office to clarify exactly, what conditions need to be in place, what suite of conditions. We've got everything in place, but we're not quite there on numbers. Can we apply, et cetera? This is, at the end of the day, the governor's decision, and we're under a state order. And so they screen where we are and where we are in relation to the criteria and let us know whether we're even eligible to apply early. So that's an ongoing discussion. So there's a follow-up question, if we had any idea on when the Board of Health might vote to apply for phase 2. I don't have any information on that, and I'm not sure whether that's the body that does that. But Dr. Spitters, you want to respond to that?
The timing to apply for phase 2?
Yes.
Well, we're putting all the pieces together and managing our response going forward with those 5 categories of activity or disease rates, et cetera. Those 5 categories are where we're focused our energy, and as we go forward, it's as though we're preparing an application, and then the timing of submission of that just depends on where the governor and the Department of Health are in terms of receiving a request for a variance. Do we have to meet all the very item you addressed? Can we submit prior to meeting all those objectives or not? So we too are in conversation with the department about that. And the answer is just as soon as we can feasibly submit one, but I can't give you a date.
Another question for myself and Dr. Spitters. There seems to be growing divide over pandemic response, specifically in this county, with multiple businesses ignoring the stay-home order, protests against the governor outside the Snohomish County Courthouse, where your own sheriff is speaking. Any comment on that? And also, what can you say to the people of your county who might now be questioning the validity of the pandemic response? Let me respond first. We know people are frustrated, and there's a whole range of reasons for that. Some people have lost family members or gone through really severe life-threatening disease. Many others in our community have underlying conditions where they feel very vulnerable to this disease. At the other end of the spectrum, you have small business owners and just people who are out of work that are feeling the economic hardship. And you've got a whole suite of people that have both undergoing economic distress and may have a family member that's been through this or lost somebody. So we understand why people are anxious. The course we are trying to chart, and we've asked people to do, is the one that we think has the best likelihood of success in both mitigating the virus, but also making sure that as businesses open, that they're going to be successful. If we open too soon, we see another wave, that's going to be a disaster for businesses. So we really are, I'm not discounting either side. They're all valid and reasons to be anxious, but we really need to stop the divisive language because we're all in this together. The best course of action is when we pull together. We recognize the concerns of our fellow citizens. We help them as best we can, but I assure you we are moving to open as quickly as possible. But when we do that, we want to be safe. And the criteria that the state has laid out seem to be a reasonable set of criteria based on science and health professionals. And we understand those and are trying to comply and are doing so with all haste. Doctor, would you like to address that also?
Well, of course, Executive Summers, and I just would echo first that there's a variety of pain and suffering, some physical and medical, others economic, social. It seems that there's no person or sector of society that's untouched by this troublesome virus and what it's caused. And there's also no pain-free exit from this dilemma that we're in. And as you've said, We're just trying to find the pathway that best balances human health, our social and economic needs, and try to navigate through that with the goal of returning to some economic activity, social interaction, but probably still maintaining physical distancing as we try to restart the economy a little bit, but not pay the price too much in terms of suffering, disease, hospitalizations in particular, because if those hospitals fill up again as they did at the end of February and early March, not only are they not available to not care for COVID patients, but all the other things, trauma, heart attacks, strokes, all those other things that we go to the urgent care and emergency rooms for. So it's a tough assignment, and we're doing the best we can to balance all the interests at stake, and we continue to do so and work at it every day.
So another question for Dr. Spitters. Did the health district approve a measure allowing Dr. Spitters to pursue legal action against businesses that disregard orders related to COVID-19?
Well, I guess the health officer in Washington state law has the power and duty to prevent the spread of communicable disease. That's written by a law by the legislature, and it's really the core legislative direction addressing this position, is to prevent and control the spread of dangerous and communicable diseases. And with that come powers to direct people, and when they present an imminent risk to others and aren't cooperating with less restrictive requests from the health district, then there is always the option to move forward with legal action. And that does not require approval from the board. It's already statutory law afforded to and imposed on the health officer position. But when we are in a situation where we may be pursuing legal, our legal counsel thinks it's wise to just engage the board and let them know what's going on and have a discussion about it, because it is a policy issue often. And so that's what occurred last week.
So there was a follow-up question that Hannah Scott wanted clarified. Is the only way for the county to move to phase 2 through the variance process criteria? Apologies. Yes, that is the process that the governor has set out, that under the state order. The criteria have been laid out. We're trying to meet those as quickly as possible. But again, it's an ongoing dialogue, and things could evolve over time, but we're assuming that we need to meet the criteria to get into phase 2 before we actually need to indicate we can meet the criteria before we can even apply. So going back, June 1st is less than a week away. So where are we with the things you can control? PPE, contact tracing, testing, quarantine. Are they ready to go for June 1st? And what is the number of cases in that 2-week period that we would like to see to get down in order to feel comfortable reopening? First of all, things such as PPE and the quarantine sheltering site are really being managed by my Department of Emergency Management. We have a huge order of PPE for all our first responders and medical facilities in the county that's waiting to go today. We were hopeful to get it out last week, but we're going to the county council this afternoon to get funding for that through the CARES Act. And that also goes to the quarantine shelter site. We currently have one at Angel of the Winds Arena in Everett. We think we will be moving that likely to the Evergreen Fairgrounds, but one of the requirements is to have a quarantine shelter site, regional and countywide nature, somewhere in the county. And again, we will be asking for the go-ahead from the county council this afternoon to move forward on transitioning out of Everett to the fairgrounds. And that was the plan last week. I assume that's the case this week, but we do want to downsize, but move that shelter. Dr. Spitters, the other factors?
Well, so our healthcare surge capacity and the personal protective equipment that Executive Summers mentioned is in good shape. I'd consider that sort of a green light. Our testing capacity in the county is good, but not quite where we want it. We'd like to see ideally roughly about 4,000 to 5,000 tests a week being done. We're at about 2,500. With the scale up of testing sites by the health district over the coming weeks, we should be able to meet or approach that measure. The contact investigation and quarantine capacity, Executive Summers addressed the isolation and quarantine site, which is dedicated for that very small number of people who don't have a home to shelter in, or for whom sheltering at home would create safety problems for a vulnerable household member. But we, our last week we started contacting the cases and the contacts directly. You may recall that a couple of months ago, when things really got out of hand and there was just too many cases, we were having to delegate notification of contacts to the cases and educate them on how to do it and give them materials and have them spread that out. But we've now taken that back over. We've got about 30 FTEs between our own staff, volunteers, and some new hires trained up to do contact work. And then we have the CARES money to look at hiring additional folks, and state capacity for a surge in cases if needed to address contact tracing. So we feel well positioned moving ahead. We're not exactly where we want to be, but I think we're in a good spot for where we are now, and can proceed in a direction with confidence that we've got that capacity to address the caseload and try to suppress transmission in a way that permits human activity in the ways we've been describing to proceed.
I'd like to go back to an earlier question that really touched on the point of whether our response to the pandemic has been overkill. And I just want to remind folks that you can't drive into Canada now. You can't fly into Europe. You can't really fly to Asia. And if you go to Hawaii, you're quarantined for 2 weeks. This is a worldwide pandemic, and that's the nature of a pandemic. But all the data indicates, and our experience has been, that this is 10 times more deadly than the flu, and numbers vary, but it's much more deadly. It's very contagious. It's a horrible way to die. We've lost over 100,000 people in this country to it. So I think the response has been significant, but not overkill. This is really something, the only tool we have really to combat this at this point is social distancing and asking people to, stay at home as much as possible, be careful. And, we need to get through this as quickly as possible, but the whole world is dealing with this. This is not a Snohomish County issue. This is not a Washington State issue. This isn't even a U.S. issue. This is a worldwide issue. And the response has been sometimes not quick enough and sometimes not severe enough. But in Snohomish County, we have flattened the curve, as Dr. Spitters has laid out, and that's what we set out to do. But what that means is the curve is flat and it comes down slowly, and we're not to the point yet where we can just declare victory and move on, because it will quickly be back. It's still in our communities and still very contagious, and we need to keep these efforts going and try to mitigate and get people working in a safe manner as soon as we can, and that's what we're doing. Follow up on the number of cases needs to get down to in a 2-week period.
The goal is 80 or less per 2-week period, and that's just based on the metric generated by the Department of Health with input from CDC guidance, and that's the goal. If we have trouble achieving it, we're gonna talk to the state about whether the strength of our overall response capacity will still permit us to move ahead. That's certainly our desire and intent. And I'd like to add on to Executive Summers' comments a moment ago that as we go forward, and ultimately we're going to make it into phase 2 here, but we're really going to rely still on people maintaining social distancing in that phase 2 and phases beyond, until we're really reached a point where we're much further down the road with this virus. And so that even if you are in a sector where you're permitted to go back to work, your business is operating, your employers asked you to come back, other than that and essential trips, we really want folks still staying at home and limiting their social circles. It's not, phase 2 will not really be opening up to having a lot more social contacts, because that's how the virus spreads. And again, about, just to harken back to 6 to 8 weeks ago, late February, well, I guess it's even longer than that now, but late February, early March, our hospitals were bursting at the seams, and we averted a real acute care crisis. That is the lack of ability to provide care to everyone that comes in, by imposing that social distancing and all the great work everyone in the community did to quiet down their activity, reduce transmission, and prevent that from occurring. And unmitigated resumptions of social activity would lead us back in that direction.
So we have a thank you here, and I just want to thank all of you too for the ability to have this dialogue, and the questions are all appropriate and ones we're being asked also. And so we're grateful for the opportunity to speak with you as often as we do, and appreciate the work you're doing getting information out to our citizens and communities. So thank you.